horror stories that we're hearing right now in dental.
I couldn't believe it. And she said that the oral surgeon in Phoenix said they were brutal with you because the amount of trauma to your upper and lower, I haven't seen it in a while.
And we bring so much receipts that I had a phone call on the way yesterday to Indianapolis from a doctor from New York. His patient came to us, got a bunch of work done, and he said, "Hey man, this work looks great. Where'd you go?" And she said, "Mexico, Supreme Dental Clinic."
People will forget what you did to them, will forget what you said, but they'll never forget how you made them feel.
The doctors are accessible and available, and you know, even when we schedule those personalized Zoom calls, those individual ones, that's free too.
Where she went with an oral surgeon and she was hospitalized. We have the pictures up here. That is unhuman.
I see people say, "Hey, what do you guys think I need? You guys need to think in your root canal?" I'm like, why are you asking a bunch of momos on Facebook what you need? They're not doctors. We're not doctors. We can educate you on the process and the materials.
And this application is completely free to you guys. It's our gift to you guys, so you guys use it to your advantage. Welcome back to Supreme Dental Podcast Studio. You can be anywhere else.
Estos son podcasts, no chingaderas.
You can be anywhere else in the world right now, but you're here with us.
The level of mastery you have on dental work is extraordinary.
Do your research.
Perfect.
This is the podcast.
Welcome back to Supreme Dental Podcast Studio. You can be anywhere else in the world right now, but you're here with us. We appreciate that. Don't forget to like and subscribe. Remember, this podcast was meant for you, our patients. My wife and I are the owners of Supreme Dental Clinic, and listen, we're on Apple Podcasts and we're on Spotify. Today we have the home team. We have Luis all the way from Chihuahua.
Hello, everyone.
Literally just got off the plane like 2.5 hours ago.
Yeah.
And then we have Indiana Royalty. We have Mr. Look at his face. Mr. Ernesto, a.k.a. Ernie, if you guys, want to talk to him. And then we have Jessica. How you doing, Jessica?
I'm doing well.
And, they also flew in yesterday. Very busy flight. Everybody's here for the kickoff meeting. Guys, it's February already. It's February. What happened to January? I'm super excited about this kickoff meeting that we're about to have. I'm super excited to just show the team what we're doing. But just with that excitement comes that it feels sometimes like it's Halloween in February. What does that entail? There's horror stories that we're hearing right now in dental. And that's something that's a big deal what we're doing this podcast and we want to talk about. So I know that Luis has a horror story that's happening right now. Tell us a little bit about the story, Luis.
Yeah, so the way I found out about it was a Facebook post, right? It was, what do you guys know about blank clinic? I went there. I had an all-on-6 treatment done, upper and lower. And right after surgery, there was no care instructions. They gave me a bag of ice. They dropped me off at a nasty hotel. And that was it. And so that turned into her rushing herself to get to the border to an ambulance. And the ambulance then took her to the nearest hospital. And then from there to an oral surgeon in Phoenix.
But everything is just like us. It's all inclusive, just like us.
Well, that's what they claimed, right?
It's instead of having the surgical wrap, they have a bag of ice. You know how many bags of ice we see? We should actually one day, JT, we should walk around Algodones when it's, full of patients and count how many bags of ice people are holding or frozen vegetables. If you guys just paid thousands of dollars, you don't think that you should be giving something, more
Just a little
professional, just like a surgical wrap? But that has nothing to do with the experience that you're talking about. That's crazy.
Yeah, no, I mean, she was promised anything you can think of, right? Because I started to ask questions. I said, well, what were you offered? What were you going to go home with? Because her thing was, I came to from sedation and they were trying to jam a healing denture into my mouth, but I was so swollen that they couldn't place it. And so I panicked and I started to, tell them to hold off. And so Yeah, she went home with nothing.
Whoa. So one more time. So the patient woke up from sedation and they were trying to put some temporary dentures in her mouth while she was waking up.
As she's waking up, they're trying to jam just a conventional healing denture, one that you use adhesive to keep in place. And that's not what she came for. You know, on paper, they told her you're leaving with an
Immediate load.
And so she went to a consult locally to 2 different dentists, and they offered that to her. They sold her on that. And so when she approached the clinic locally and they said, "Oh yeah, we can do that for you," she was sold on it, right? She said, "Okay, well then, if the U.S. dentist is offering me that, and they have it, why not for less?" You know, because that was a big thing. Is this treatment usually goes for $25,000, but if you commit to it now, we'll do 18, 20,000, no more than that.
Tell me, what are you doing down here in Mexico?
Yeah, that's a very interesting experience. You know,
Yeah?
I had one of my best experience in my dental career.
Really?
Yes. So I was invited to this place, Supremedental Lab, and give some hands-on course, basically teaching the technicians how to create beautiful full arch restorations.
That was interesting. And if you want to keep on watching a little bit more about that, make sure you click the link above. Now let's go back to original programming. You know, that is something that's something that happens all the time. When I know about some clinics through dentists that we have with other dentists from other clinics that say, we don't know how to do immediate loads, but we sell immediate loads to the patients and we give it to them at no cost. That's why the price dropped. And when they wake up, we let them know, hey, you know what? In your case, we weren't able to load your implants because we didn't get enough torque. How do you argue with a dentist? You don't know that. So you're like, okay, well, I must have had really bad bone structure or whatever it is, or bone density. And it's a BS lie. It's just they knew from the beginning. But they made you compare, for example, she didn't shop with us, but if it would have gone with us, it would have been like, well, they're cheaper and they're also offering me the same. Yeah. These clinics already caught up. They caught up to what other clinics are doing. Well, what we're doing, right, they can't do it, but they act like they are. And then at the end, the results are awful. So she went back to the United States. And she had to go to an oral surgeon in Phoenix.
In Phoenix, yeah.
So what did they do? They send her in the hospital, in the ambulance? Or how did it work?
Yeah. She went there in an ambulance and she was hospitalized for a few days for a serious infection she was running. Yeah, and she sent me photos of the implants, and we'll have to share those so that
you want to put them up, JT?
Yeah, so you guys can do a comparison. And when I started to speak to her, I said, listen, there's a chance that you might have a hard time finding someone to finish the work for you. If the placement of the implants isn't ideal, you're going to run into the same situation I ran into where it was just botched work. They had to pull everything. And she's like, no, don't tell me that. And I'm like, well, let's see the placement of the implants. And I believe you commented when I shared a photo of them, right? She's probably going to have issues for sure.
But she saved money.
She saved some money, but I think it's going to cost her a lot more in the long run, unfortunately.
This goes to the point, and I'm sorry, I know you were about to speak, but guys out there, I know that sometimes you guys compare us or compare high quality dental clinics. We have 10 international accreditations. That aside, you compare us to other clinics. And when you do, you say the other clinics are just the same. We hear these horror stories all the time of clinics that say we have the same, we've worked there before. There's agencies that say, oh yeah, that doctor used to be their head doctor. All the time. Do not let yourself be wrapped into something like that. You know, do not let yourself be lied to like that. Do your research, but by doing your research means actually do your research, not just ask that place, are you good? Because they're not going to tell you, yeah, no, we suck. Because then these things happen. You think you're winning. It's like you're going to go to Louis Vuitton and then you buy a fake Louis Vuitton. It's a fake Louis Vuitton. Now, this is health. This lady went through pain. You said she woke up from surgery. They were trying to ram some conventional dentures in her mouth, which she didn't want. They gave her a bag of ice. So it's like, here's a bag of ice. It's magical.
No post-care instructions.
No
just-
post-care instructions. Then she went to the United States. She had to go to the emergency room. They took her on an ambulance to Phoenix, where she went with an oral surgeon, and she was hospitalized. We have the pictures up here. That is unhuman.
I saw those online, and I mean the just the pictures were, I've never seen
It looked like a
anybody.
mugshot.
It was bad, but I mean she was swollen even all here, like it just I've never seen anybody. I've seen many of our patients post operation, post surgery,
Yeah.
and they don't look like that. Actually, we have people that
Yeah.
record their video right afterwards, and they're like, I've got my immediate loads in, and I'll be back in 4 months.
She
And so
said-
that's like nothing.
She said her surgery was 2.5 hours. Like, what? She's like, yeah.
They're racing through it.
Top and bottom?
Yeah. I couldn't believe it. And she said that the oral surgeon in Phoenix said they were brutal with you because the amount of trauma to your upper and lower, I haven't seen it in a while.
And then you have those clinics that you have that doctor in the United States that's seen it, the oral surgeon.
Oh, now he's screaming.
Mexico.
Look at what they do in Mexico.
Look what they do in Mexico.
Oh, yeah.
You know, we could say this is what they do in the United States. We'll put a picture up here, JT, if you want to do that for me, please. We'll put a picture up here of an implant that looks like a screw that I got from Home Depot.
It looks like drywall,
And it's-
drywall scroll.
Two of them, two drywall screws,
Yeah.
some cheap ones, holding on a crown, and then another screw holding on, I don't know what was supposed to hold on to. And that was in the United States. See, there's bad dentists and good dentists everywhere you go. But I have a horror story also for you guys before. I know you guys all want to get into this too. Ernesto hasn't said anything. Look at him. I remember, I don't know if you remember, but actually, hopefully this doesn't bring flashbacks. But the doctor who actually did surgery on you in the other clinic that you went to had a clinic. And there was this patient that came to us and I think decided to go to the other place or somewhere around there. I don't know. I don't, it's been years. And all of a sudden he said he woke, when he woke up, when he came to sense, he was sitting on a curve. And he went across. They were telling him, go, the border's going to close, So this was like 2020, 2021 when they were closing the border early.
They rushed him across the border. Yep.
He went to the United States and he was hospitalized for quite some time. Then he said, guys, we seen it was really bad placement on implants. Then he came back and we literally told him, we can't work with this. It's like you have your foundations like this.
Mm-hmm.
It was awful. They didn't do bone regeneration. They didn't do nothing.
They didn't
And
regularize the bone. Yep.
I mean, it was just awful. It was just awful. And guess what? Then all of a sudden when he came back and then his girlfriend, when I crossed the border, was yelling at him because now he had to redo everything. And we see this all the time. And patients out there probably say, yeah, you're lying. Yeah, you're just telling this to scare us and you want to charge us more because you want to keep on paying for the podcast or whatever they might say, These are the results. That's
Yeah.
what we say. Do your research. Look, if you don't come to us, pick whatever is the best fit for you. But please, these horror stories, guys, they're butcher shops. They're butcher shops. Do not butcher yourself.
Yeah, no, and to piggyback a little bit about doing the research, when I spoke to her, she told me she did extensive research and she got photos and she got, I mean, you name it, she asked for it, right? And so she said, I wasn't price driven because it wasn't the cheapest option either, but I did believe everything that they said. I think when a patient goes through a scenario like that, if you show up to the clinic and the clinic is a 1 or 2 chair type of clinic and they claim to have a state-of-the-art facility, that should be a red flag. If they claim to have their own lab and they can't physically take you to it and
That's a
show
lie
you
right
the
there, yeah.
equipment, that's a red flag. And that's where she says she dropped the ball, right? That should have been a red flag enough to say, wait, hold on. And maybe went elsewhere or a second
Absolutely.
opinion or something, right? And so, yeah, so if you are doing your research, do it and then fact check them, right? Show up.
It's okay to
Yeah.
ask, well, let me see it.
Mhm.
It's okay. And you're paying for it.
Yeah, we talk about this a lot, where we're a very transparent clinic, right? And we're not going to tell you what you want to hear just to get you in the door. And when we tell you we have something, we show it. We love showcasing our technology, our doctors, their skill set, us as individuals, the brand itself, everything, right? Like our lab, the milling machines, the Big Dental, the Shining, the Carestream 9600, the Almond Gerbach Zirconia pucks. I mean, it's there. We're not afraid to show it. When it comes to doing your research, go beyond the price. I had a patient, I told you, that reached out and said, hey, can you guys do any better on finishing my bridge? Because I found a reputable, a highly recommended doctor in town that'll do it for, this much cheaper. And I was like, do you mind telling me the name of the doctor or the name of the clinic? And she told me, and I told you who it was, Schmauschmasters. And I said, no, not them. I said, not them, ma'am. I said, they pride themselves on that big old building and free tortillas and a bed and breakfast. They have to bring in outside doctors. They don't have their own lab. And if they do have a lab, it's like a microwave, I mean, all of it. And it's not because we're trying to be pompous or arrogant or anything like that, but we bring receipts. And we bring so much receipts that I had a phone call on the way yesterday to Indianapolis from a doctor from New York. His patient came to us, got a bunch of work done, and he said, hey, man, this work looks great. Where'd you go? And she said, Mexico, Supreme Dental Clinic. And so he started asking me questions because he wants to refer a patient out to us. And I started firing off the questions, and he's like, damn, man, you're really detailed. I'm like, yeah, thank you. And I followed up with him via email. So the fact that a doctor from Manhattan, New York is even willing to come or to consider us, says something. 98% of our patients are from the U.S. Oddly enough, Mexicans don't go to Mexico for their dental work, right?
This is true.
And with that being said, it's never a matter of scare tactics, fear porn, of trying to not get you to go anywhere else. But like Frank said, if you don't come to us, make a well-informed decision and look beyond the price. Whenever we give you estimates over the phone, whether it's Luis, Jessica, myself, Leslie, the front office staff, go line by line, see everything it includes. It's like that patient that reached out and then, I spoke to the husband, the wife needs a all-on 6 top and bottom. So I talked about the all-inclusive, what it includes, everything like that. And he shoots back with, I'll give you 20 grand cash. And I said, sir, with all due respect, that we both know that this would be that much more in Orange County, California, where you're calling from. And so we can't budge on the price. Because here's the thing. Do you want to treat your oral health like you're going to the swap meet or AutoZone and say, hey, man, I'll give you $250 for that battery?
Now, what if I told you, hey, you know what? Give me those $20,000, but let me take down this value. Let me get a dentist that just came out of school and that says that they do an all-in-4, but they're just an implantologist. Let me get some of that Chinese zirconia. Let me get some of those implants that are clone. And I got you.
Local anesthesia. We'll just, we don't need to do IV
Tequila's
sedation.
fine. JT's, he probably could do some implants. You know what I'm saying?
You could
Yeah.
rehire that assistant that you let go that wanted to do implants. Just
There
said,
you go.
I got the skill level. Just
I do
let me
think-
add
Yeah,
him.
we got Manny GPT. You give him 15 minutes, he'll figure it out. Boop, 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 boop.
GPT.
You know what I'm saying? Like, it's you can't do that. You can't, and it comes funny to me because I know it for a fact. It's because we're in Mexico. Because if we weren't in Mexico, you don't call a U.S. clinic and say that. Well, I'll give you a Coke and a smile. It doesn't work that way. But back to what you were saying, it just blows. That's what really blows my mind is that how patients are getting, there's just so much confusion out there, and it's scary because you might say, well, who do they believe? Because they're gonna say, well, who do I believe? I mean, you're saying this is good, they're saying they're good. Well, ask and compare.
I do think
Yeah.
that people are. I do think that patients are really trying to do their research. They just don't know what to ask because we're in those Facebook groups where everybody's giving each other advice, and their posts are, where's the best place to go to in Mexico or Colombia?
Yeah.
And it's, I guess it's a good start because they're starting to collect names as to where to compare. But now that you've got the names, what are you looking for? Do you know what you're looking for?
And then you got the ChatGPT doctors that are saying, oh, no, you don't need that.
Oh, yeah.
You don't need that. Where did you go to school?
Oh, yeah.
Yeah, man, it drives me bananas when I'm on Bookface, which I don't really like to be on a whole lot.
Bookface.
And
This guy's full of surprises.
I hear people, I
them all.
see people say, hey, what do you guys think I need? You guys need to think a root canal? I'm like, why are you asking a bunch of momos on Facebook what you need? They're not doctors. We're not doctors. We can educate you on the process and the materials.
But
But we
talking
have
about
access to the doctors, though.
and talking about not being doctors, guys, I want to give a huge shout out to you guys because there's people that like what they do, and there's people that love what they do. So I'll send you a couple pictures to put out here in videos, and I'll put my finger right here, exactly right here is where I'm gonna show you that there's people that like what they do and there's people that love what they do. What do I mean? Ernesto came in, and you'll see in the picture right here that he was actually talking to a patient, telling the patient exactly what was going on. He because he actually wanted to do it. Then we have Jessica right here. When she's actually looking at an X-ray with Dr. Luis. And that's when she literally just came in, like after being awake since like 2 a.m. And then we have Luis right here that a patient asked to take a picture with him because it was like, oh my gosh, man, I am so happy that I met you. Bro, it was like, he even told him he was a good looking guy. Like, I don't know, he might have been drinking right there, but I'm not gonna judge him, But
Let's give him a shout out, Art Hernandez.
there you go, Art. And Art, Art's a great guy.
He's great.
He also said this about us, and I'll post a quick video. And I've known this guy for quite some time. Look at that smile. Look at that supreme smile. But he talks good stuff about us, and he says that that it's way better than going to California. He has an amazing supreme smile. But you guys really like what you do because you guys are not just going to sit there and be like, well, I just talk to them on my house, talk to them on the phone, and that's it. You guys come down and you guys actually care. And that's the type of staff that I want in my side. People that care. Look, staff comes and go, guys. And what do we read? We're reading a book right now. Mm-hmm. And it says, people will forget what you did to them, will forget what you said, but they'll never forget how you made them feel. And there's patients that come down, and patient Art told me, you guys made me feel like family. You guys made me feel home. I'm so comfortable here.
Unreasonable Hospitality.
Unreasonable Hospitality.
Such a good book.
My wife, told us all about that book, and she has us all reading it. De Grande from Valuetainment, she referred it to my wife, actually gifted to her. And it's been a blessing, it's a blessing, and that's the difference, guys. The difference of what we're doing here at Supreme Dental. It's you guys, it's the dentist, it's JT, it's Carlos, it's me, it's everybody. We're all part of the product. We're all part of this product. And me hearing these horror stories just really pissed me off and I'll tell you why. Because that patient, they say, I don't know exactly where she financially stands. Some people are very blessed. Some people are not so blessed.
That could have been her life savings.
That could have been her life savings.
It was. She's a single mom. She's got twins.
There you go. There you go.
She's got twins, and she's like, you don't know how hard it was to save up the $10,000 that I paid to start this.
And somebody just destroyed that. Somebody took advantage of her because that's what it is. They took advantage of her. Took advantage of her situation.
Big time.
And now she's in a place where now she's scared. Everybody's gonna be like, I don't want to go to Mexico.
She's not gonna. Who's she gonna trust?
And you just destroyed someone's life, perhaps.
And not just that, but the stigma you're feeding, the clinic that did that, it's feeding into that negative stigma. And just so you guys know, obviously we're biased and we're going to say, hey, man, we consider ourselves, top dog. But there are good people and good dentists that do care about your oral health.
Absolutely.
And if they would shun those people, if we could take a vote and close that clinic down, we'd probably all vote, dude, they got to go.
There's dentists that I know, there's some dentists that used to work here. Great dentists. some not so great dentists. But I know a lot of dentists that would love to slap those dentists up, because that's a shame of a professional human. That's a shame of a human
Yeah.
overall.
Yeah.
Because the work that they're performing is not even underwhelming. It's unhuman. You know, and someone's life just got really hurt. Physically, mentally, she's devastated.
Financially.
She's not going to trust the world. She's not going to smile. You know, and somebody took advantage of her, and they're like, ha, ha, ha. Maybe they did their best work. Well, maybe they shouldn't be doing that type of work.
Maybe all they're really good at is general dentistry. They just need to stick to that.
That's exactly right. That's why, I don't know, some of our doctors go around the world. I don't know. That's why we're doing, you know, the first zygomatic in Straumann's history. I don't know. That's why we have 10 international accreditations. I don't know. Maybe that means something, guys. Maybe that means something.
It's got to mean something.
You know?
And, you know, we have some new hire dentists, and, you know,
They're under supervision.
They're under supervision. And no, they really are. And our tenured doctors, like Dr. Dutzen, Dr. Luis, are, you know, like checking out their work, their preparations.
Dr. Deuce is a tough one.
You know, she's a tough cookie, man. And, you know, it's not just like, yeah, that'll do. No, I don't like it. I don't like that prep work. We got to do this. Now,
We got to redo it.
we got to redo it. And
She's
she's
known
taking
to
them
do
under the
that,
wing.
yeah.
And she said, hey, this is what we expect. This is what we expect. And so, yeah, we hold ourselves to our high standards. You and Aida hold us all to a high standard. And back to, you know, the Facebook thing, I think there's a lot of ignorance. And I think the word ignorance, just so you know, means you don't know. It doesn't mean you're an idiot. It means you don't know. Hey, I'm ignorant in the subject. Just like how often do we get, I want veneers, and their teeth are cracked, they're this and that.
Missing.
They're missing teeth, yeah.
Hey, you know what? You're not a candidate for veneers, and this is why. Let me educate you, you know?
Yeah.
But this is how we can help you. You know, you are the busiest one on social media, and I love it because every time you go in there, your angle is educating, and this is how we can help. You're not condescending. You're not saying anything. You're not saying, "Oh, you moron! You thought you can get veneers." No, you know, you're in the comments too. You know, telling patients,
Yeah.
"Hey, this is what you can get. What can be done." All day long. And that's where we like to educate. Hey, I want you to have a good understanding of what your treatment plan can consist of. Now, with that being said, you know, the CT scan will be the blueprint that we use to come in with your best case scenario. Like the patient this morning that I was talking to with Dr. Adolfo, you know, it was like that training we did yesterday, that the role play. She's like, well, my doctor back home told me they can do a bridge and they can do that. And Adolfo said, I can do the same thing, but it's not going to last. It's not going to last. And I said, you know what? If what we can do for you isn't going to last longer than a few years, then that's patchwork, and then we don't believe in that. And so I even brought out the prosthesis with the titanium bar. I had her hold it, all the things. I want you to understand what we're talking about. This is what all on four means. You're probably hearing, we're going to yank out of your teeth. Yes, we do need to extract out your teeth, but this is why. All right, let's educate you on that so you feel good about what the process looks like. And don't walk out and talk to the felon down the hall that's like, hey, yeah, you know, so we're all part of the same family, and
I was
you know.
listening to his spiel this
What was
morning.
he saying?
Oh, somebody was saying, so he caught some unsuspecting snowbird couple that were walking by, and he started asking them about how their experience was. I don't know where they were coming from, but they were coming from another clinic, and she said, well, they seem to be really good where we went. I think we're okay there. And he was like, well, there's good, and then there's excellent. And I was like, wow, that's very profound.
I should have piped up like, man, you better hope that shit works.
Well, that was deep right there.
It was profound. I was moved by that.
You're about to go into his clinic.
Dude, I was about to go get my cleaning there instead
Sign
of with
me up.
Charlie.
Can I get some veneers over implants, please?
Sign me up.
For sure, right?
Can you do a root canal,
Yeah.
then extract my teeth to do implants? I heard that's the best way.
Yeah.
Luis, because you're the busiest one on Bookface, bro, what do you think is like the common theme in patients and their inquiries and their questions?
And also, you're really good at untoctic. Yeah, I'm getting right there. Oh, look at
Nice,
that. That was
nice.
quick. That was quick.
I think actually my last 4 appointments have been from Tactic.
Talked. Ooh,
Ooh, nice.
So yeah, I got to stay on that for sure. I think a lot of the times patients have this idea of wanting to change their smile, right? And they often base it on what they see other people commenting or saying, like,
Yeah.
hey, I'm going to Colombia for veneers. And I've seen photos where people will post like, hey, I just got back from Colombia and I lost this veneer, and the tooth is shaved down to a nub.
Yeah, that's
And
not
then-
a veneer.
and then
You sure that's a veneer?
And then everybody roasts them, right? Like, you might want to double check your work because that looks like they shaved your teeth down to a nub. You have a
Yeah.
crown. That's not a veneer. And so often they're just misinformed, or they don't know what
think
treatment
when
it
they
is.
ask for veneers, I don't think they necessarily even and again, you don't know what you don't know out of, and that you don't know anything until you need something, right? But I think when they're saying I want veneers, it's because what they're really saying is I want to fix my smile. And everybody under the moon wants veneers right now because it's so heavily marketed. I wish patients would ask the questions I wish they came at me with, because the first thing they ask for is price, right? But the questions that I wish that they would ask is where have your doctors done continuing education? When's the last time they went somewhere to brush up on their skills? What do your accreditations mean? What, stuff like that. I wish that those are the kind of questions that we have, because we usually try to redirect that way, but they come in focused on something else that when we try to redirect into that direction to say, hey, these are the things that matter. Let's talk about these things. It's kind of, it becomes a little hard to go that way.
I don't think I've had one patient ask for x-rays from the work that we put out.
That's another
Not
thing.
one,
Yes.
Not one has said
The
hey,
accountability
yeah.
x-ray, like what do your teeth, everybody shows like, these are what my all on fours look like. And you see the pictures and, most of, they look fine. Excuse me. But I want to see the accountability x-ray. What do the position of those implants look like? Because we've been passing some around. You've posted some in our
We'll have to
work
share
group.
some.
Oh my gosh, the ones from Turkey.
Yeah.
You've got they're staggered. They don't, it's.
We'll put a
it's
picture of that right now
Yeah,
too.
we,
Sure,
and we
right
joke
there.
around about this is what $6,000 gets you, right? Because that's what they lead with is we can get you an all-on 6 for $6K.
Short,
and-
stubby
yeah.
implants, horribly placed.
Well, I think this is where another part where Supreme Dental shines is that we think outside the box. And so now you have Luis and Jessica who are going to start hosting Zoom parties on social media and on
We
Zoom.
are.
So patients can sign up. They're free. We don't charge. And it's going to be a Q&A with a doctor, with 2 amazing patient coordinators who can control the chat and answer all your questions. And the doctor's going to be there. Hey, who better yet than the source, right? And so when you think about who you want to work with, why not work with a clinic that's opening themselves up and saying, hey, man, here we are. Let's answer your questions. We're not being gimmicky and saying the first 5 people to sign up get a free stuffy, nothing like that. We're just saying, hey, look, we're going to give you some educational resources,
Maybe a keychain.
maybe a
Take the
keychain
stuff you have.
to make sure that when you do make your decision, you're informed. And how often do all of us get to include you and myself? Hey, it's because of you, the podcast, or because we tell patients, hey, man, we're here from beginning to end.
And guess what? It's free. What you guys are doing is free.
All this, yeah, it's free. We're
Free
gonna
information.
spend an hour with 20, 25 people online. The doctors are accessible and available, and even even when we schedule those personalized Zoom calls, those individual ones, that's free too. I mean, back in the U.S. telehealth, what does telehealth charge?
$50, $60
at least.
Yeah, for a telehealth call.
But I mean, you guys both are both have been to trainings in different parts of the world. You guys are both, been in dental for quite some time. Then you have 1 to 2 dentists that are going to be on the call. And this is free for the patient. The patient can go ahead and ask whatever they want to ask dental.
Yeah.
And
I
it's
have
free
the
to them.
procedure too, so
You have the
Got the product in
procedure.
his mouth.
Yeah, and you have the product in your mouth too, and she lives with you. So, I mean, obviously she's your wife. And
I haven't
and
had to super glue back anything.
not
in
yet.
my mouth
We're good. We're good.
We're good.
And
We've hit the 1 year mark.
yeah, don't push it.
already,
Don't
right?
push it. We're good. We're good. And so, guys, take advantage of this. Take advantage of. This is free. This is for you guys. Hopefully, you guys decide to come to us. But if you don't, you know what questions to ask. you know what to look out for. So you don't get ripped off and you don't have these horror stories and they say, why didn't I listen? Why I didn't know? That's what the doctor said. That's what the doctor said. Nope. Now you know that there's a place that's going to give you the right information. No, we're not ChatGPT. We're real people, and we're going to give you that information. We will have ChatGPT, though, on our application that's coming out, which is going to be, the ChatGPT's name is going to be Juan. Because how many of them do you need to answer all your dental questions? Only Juan.
Only one.
So that was my wife right there. And they'll be able to go ahead and answer any questions you guys have for dental, and also do an AI-generated smile for free at no cost, before and after in 8 seconds. Even if you have teeth that are not for the first time in this company's history that's helping us out. It's going to have navigation, satellite navigation. It's going to have so much more. It's going to be, it's not just an application, it's a dental community. So make sure you download this application. All the webinars, when we start having this application, will be on this application. And this application is completely free to you guys. It's our gift to you guys, so you guys use it to your advantage. If you guys want to finance, you can. Any questions you guys have, even if it's whatever dental question it is and you're not going with us, it's still going to respond to you. It's free.
Yep.
You know, but we're taking that time because we want you to have those tools. We want you to be informed. We want you to do your research. I would want to go to a place that's telling me, hey, we're open. Hey, this is what you got to look for. Hey, pull us apart. Because you're going to find the place that you want them to do your smile. It's going to be the best results all day, every day. But thank you so much for being here today. I know that you just came in. I know you guys just flew in. And I know that everybody's tired. So any last things you guys want to say before we wrap up? Yeah, that's a great conversation right there.
No, I just think that, some things are never going to change when it comes to dental tourism, and that's just going to be the amount of research you put into it, asking the right questions, making that well-informed decision, and not being afraid to peel back all the layers. And while you might hear, man, you guys talk about not leading with price, because we know Luis from first-hand experience knows what happens when you lead with price. We know the back-end horror stories of what happens when you lead with price, and you're going to get that good old boy that says, yeah, man, you go down there, they're all the same, man. They're all going to tell you the same thing. And you know what? Yeah, a lot of places might tell you all the same thing.
They're all the best.
They're all the best. They're all this. They can promise you the best waffles and whatever the case is. But, go on our social medias, watch the podcast. And you know what? A lot of patients do. They'll come down, they'll spend 5 days. And the first half day, they'll probably do some, shopping around. Come check us out. Talk to the doctors. Talk to, Manny, Alex, and check out the lab. Noemi, get a feel for it.
Yeah, and if you're on the fence, give us a call. We work from home. We are on different time zones. We are known to we'll talk to you as many times as you need to. I know that there's patients that come in after months, sometimes years of going back and forth communicating with me, and sometimes it's finances, sometimes it's still making the decision, whatever it is, but pick our brain. There is not a question that we're going to shy away from or try to sweep something or, make it sound better or smooth it over. We're going to give you the straight talk, and that's pretty much what we're here for.
My patient that's booked for March 2nd, her initial contact to me was January 25th of last year. It's been a year. It's been a year, and I think that's a credit to all of us, man, is that, we're not high pressure, high sales tactics. When do you want to come in? Do you want to come in right now? Well, what's holding you back? All these things. Yes, we're going to, push back in regards to like, well, this clinic told me this over here. Yeah, all day, every day. That's our job, right? To make sure that you're educated and you know what the difference is. But we know life happens, man. People have kids, graduations, and car dilemmas, and, their plumbing broke, and they have to prioritize that. We're still going to treat you human, just ask all the questions you need to.
Ask away as many questions as you have. Yeah, absolutely. And come down and meet the staff, get a walk around through the facility. If you see something you don't like and you want to shop around, you can do so. I've had patients do that for whatever reason. Sometimes it's price. And they walk into the other clinics and they walk right back over here and they say, those aren't options I want to go with. And they end up getting work done with us.
Yeah.
Well, thank you so much for being here today, guys. Excited about the kickoff meeting, and we'll have a little podcast about it. Probably you guys will be gone. I don't know if we could pull it up and do it before we leave, but nice having you guys here. And this has been Supreme Dental Podcast Studio, powered by Supreme Dental. Just like the home team, keep on smiling.
Supreme Dental, this the pod, speaking facts, trying to teach, talking health, talking teeth. Supreme Dental, Supreme Dental, Supreme Dental, this the podcast.